Sonia, an 8-year-old girl, blanks out for a few seconds and stops dancing during her ballet lessons. Her teacher calls her name, but Sonia doesn't respond. She blinks unusually for a few seconds, and then she's right back to where she left off in her dance routine. Sometimes she has more than 50 of these spells in a day. Sonia is affected by childhood absence epilepsy. It is a seizure disorder that may pass unnoticed by friends, family, and teachers. A child may seem like he or she is daydreaming or being inattentive while in actuality a seizure is occurring. After the seizure passes, the child resumes what they were doing as though nothing happened. During this presentation, I'm going to cover information needed to understand childhood absence epilepsy, including symptoms, diagnosing, and treatment. To begin, I'll start with some key terms like epilepsy and seizures. Epilepsy is simply defined as a condition with recurrent unprovoked seizures. When 2 or more seizures occur, an individual is diagnosed with epilepsy. The term epilepsy is just not one seizure disorder. It is a diverse classification of seizures. The classifications are based on the clinical manifestation, the mode of onset, and the clinical syndrome. A seizure occurs when the electrical activity in the brain malfunctions. Instead of discharging electrical energy in a controlled manner, the brain cells keep on firing, resulting in a surge of abnormal energy within the brain. Childhood absence seizures are classified as generalized epilepsy, or a seizure disorder affecting both hemispheres of the brain. Absence seizures primarily consist of brief episodes of staring, in which the child's responsiveness and awareness is impaired. There is no aura or warning sign before the seizure occurs, and immediately afterward, the child is completely alert. The cause of absence seizures is unknown. It may be associated with head injuries, brain tumors, or infectious illnesses. It may also be a genetic component, suspected or present. Absence seizures more frequently occur in females than males between the ages of 4 and 14. Regardless if the child is male or female, younger or older, the symptoms are the same. The symptoms are divided into 2 categories: simple and complex. Simple absence seizures are a temporary loss of consciousness. The seizure consists of staring spells with a sudden pause of ongoing activities like an interruption of speech, walking, or eating. A child may seem like he or she is daydreaming or being inattentive. The child's eyes may become vacant, roll upward, and the eyelids may droop slightly. The seizure usually lasts less than 10 seconds, but can last as long as 20. After the seizure passes, the child resumes what they are doing as though nothing happened and usually have no recall of the event. Complex absence seizures are associated with symptoms in addition to those seen in simple absence seizures. The symptoms of complex seizures vary from child to child. They may include a repetitive motion of lip smacking, chewing, grimacing, yawning, fumbling with clothing, or a repetitive hand movement. Other symptoms may include pupil dilation, flushing, salivation, or urinary incontinence. Complex absence seizures usually last for more than 10 seconds. Once the symptoms are noticed, the child should have further testing to evaluate the spell. An EEG, or an electroencephalogram, is the primary method of diagnosing and evaluating seizures. An EEG records the electrical brain activity through sensors placed on the head, which are linked to the computer. The computer records the electrical brain activity as wavy lines on the screen. This would be an example of a normal EEG. Certain conditions like seizures can be seen by the changes in the normal pattern of the brain. An abnormal pattern seen for absence seizures is 3 per second spike in wave. This is the 3 per second spike in wave compared to the normal. You can see the discharge lasts about, in this case, it lasts about 4 seconds. In an ideal EEG, you would capture one of the spells, but it's not necessary to diagnose childhood absence epilepsy. Once the child is diagnosed with absence seizures, the treatment plan is developed. The appropriate anti-epileptic medication is selected. The most commonly used medication is Speech.Avi. With the assistance of medication and the support of the family, children's childhood epilepsy can and do live normal lives. Although childhood absence epilepsy is a subtle seizure disorder, there is no reason it should pass unnoticed and undiagnosed. Absence seizures are frequent and brief episodes of staring and occasionally are accompanied by other symptoms. When it comes to diagnosing and evaluating absence seizures, an EEG is the primary method. Children diagnosed with absence seizures are no different than any other child and should be encouraged to live normal, active lives. Over time, the majority of children grow out of the seizures. However, half of them develop more involved seizure disorders. Sonia, who I spoke of at the beginning of the speech, who is now 10, has been seizure-free since she was formally diagnosed with the assistance of her medication. She continues her ballet and without any concerns to her condition. Although her future is unknown, her and her parents are both positive about the outlook and look forward to the future. Thank you.